Well, we're reaching the end of the month, so it is time to check in with infectious disease doctor Zain Chagla for an update on all things health-related, health news we can use. Good morning, good to see you.
Hi, good morning, Bob.
Let's talk about timely news. Toronto has declared an outbreak of meningococcal after one person died, two infected. First of all, what happens with the condition meningococcal? Is it contagious, and what treatments are out there, and how much of a threat level here?
Yeah, so this is a bacterial infection that typically resides in people's noses, but very occasionally can go into people's brains, lead to meningitis, which can be very serious. People can die, young people have died, and so very, very important that we take this seriously. It can spread through very, very close contacts, so droplets, saliva, so you really have to be in really good contact with individuals. It's not something that when you walk by someone is a big deal. But we have seen outbreaks on university campuses, particularly in dormitories. We've seen outbreaks in military barracks. And so really important that people going into these settings, adults between the ages of 20 and 36, know their vaccine status. And if they haven't been vaccinated, particularly over grade 7, should be getting a dose of vaccine, as it is very protective against this disease. And unfortunately, this is a disease that can kill young people that are completely healthy.
Yeah. Now let's talk about RSV disease. I'm asking about that because Pfizer has just announced a breakthrough with a vaccine candidate for this. So what is RSV? How serious is it, and how common is it?
So RSV is another virus, respiratory syncytial virus. It's one of our seasonal respiratory viruses that we see causing coughs, colds, but in very vulnerable populations, particularly those who are young, under the age of 1, premature, and those who are old, there is a significant rate of hospitalization and even death that comes from this disease. And so this is, prior to COVID, one of the biggest threats for an infectious disease that we keep circulating every year. There's been a renewed focus on vaccinations in this context. So really good news to see that there may be a vaccine that's effective, particularly again for elderly individuals who suffer a lot with this disease. And the hope is, and many companies are looking at this, is really putting all these vaccines together as a single respiratory shot in the flu season rather than doing separate vaccines. So an influenza, RSV, COVID shot, which again would help protect elderly individuals, maybe even some of the younger individuals, from getting all the complications during the winter season.
Yeah, well, it'd be great having a shot like that. Now, with COVID, a virus we're all too familiar with, Paxlovid, the pill you work with a lot, but there's new data on its efficacy, which maybe not as good as we had hoped?
Yeah, this is a retrospective study. So, again, there's always some biases looking back, but they looked at individuals under the age of 65 and over the age of 65 who got Paxlovid. They saw there was definitely benefits in those over the age of 65 in preventing hospitalizations and deaths. So very important that elderly individuals, and in Ontario, anyone over the age of 70 is eligible and should consider this as part of their COVID treatment. But in younger, healthier individuals under the age of 65, there was little benefit in preventing hospitalization. I think we already know this, though, that young people who have had a full vaccine series are at very low risk of ending up in hospital. And I think the study confirms that even more, that taking the pill doesn't necessarily change a very low risk to an even very lower risk. But it does show us that elderly individuals should really be considered for this therapy because they're at higher risk. And again, that they benefit from both vaccines and treatment and keeping them out of hospital.
Okay, you mentioned that super shot earlier. Ahead of that, when do you expect to see Omicron-specific vaccines coming to Canada, and should one wait for that shot?
Yeah, I mean, they're not Health Canada approved yet, but very close from what I understand. The FDA has approved a BA4, BA5 shot. The UK has approved a BA1 shot. The supply is apparently starting to be made. And so I wouldn't be surprised that we start seeing this in late September, early October on the market. If you are a high-risk individual, elderly, immunocompromised, multiple medical conditions, it's probably worth it to get your shot now, regardless of what shot's available. But if you're a low-risk individual that wants something going into the winter season, that's probably worth waiting for, as it might be a bit more long-lasting than the current shots on the market to prevent infection.
Okay, that's our time, unfortunately. I should mention on a personal note, I'm retiring at the end of next month, so I think this is our last time
Oh,
chatting.
my Lord.
So I just wanted to thank you. It's been great getting to know you over the years and learning so much, and you've just been so fantastic, and Morning Live viewers will be seeing lots more of you. But again, this is my last chance to chat with you, Zain, so I just want to thank you so much. And by the way, all the aforementioned diseases and conditions, do you do house calls if I get any of them?
Yeah, of course. Anytime, Bob.
Okay, thank you, Zain.